Hi, welcome to another one of our Dr. Foot videos. This video is actually inspired by a very close friend of mine who lives in London, who phoned me recently. Actually, he didn't even phone me, he WhatsApped me because he doesn't even get the chance to phone me, to say, I think I've got plantar fasciitis, I've got heel pain, can you send me a few products? Me being the awesome friend that I am, because I am, I sent him a whole lot of different products. I know my friend. He's incredibly busy, incredibly successful. He doesn't have the time to go and see a podiatrist. So what he did was, he must have diagnosed it himself. He must have Googled heel pain, come up with the diagnosis of plantar fasciitis, and thought, okay, I've got this, I need some products for it. There's so many different causes of heel pain. Often patients come to myself and other podiatrists having self-diagnosed themselves, but very often it's actually not plantar fasciitis. Now, what is plantar fasciitis? The plantar fascia is a thick fibrous band of tissue that attaches at the bottom of the foot. This red bit here. It can get inflamed and it can result in pain in the heel and the arch of the foot. It's often worse first thing in the morning and after periods of rest. There is a lot of debate about, is it the whole of the fascia or is it just the insertion of the fascia? Now, plantar fasciitis means that it's currently inflamed. It doesn't necessarily have to be that it is currently inflamed. It can be plantar fasciosis, which means there have been changes that have occurred in the fascia itself. Now, there are other causes of heel pain. One of them is when the heel pad, which sits here, which is fibrofatty padding, gets damaged because of impact or because of wear and tear. We can get this better quite quickly too. The other main causes tend to be neural. So sometimes there's a lateral calcaneal nerve here that gets impinged. It's called Baxter's heel. We treat that differently to plantar fasciitis. That results in a lot of pins and needles. Sometimes something called tarsal tunnel syndrome, when the nerve there's a tunnel that runs here that gets impinged. It can produce similar symptoms. Sometimes, and very recently, I had a patient who came into me complaining of heel pain. What he actually had was insertional Achilles tendinopathy. So the Achilles tendon is a very strong tendon. It runs down the back of the leg and attaches to the back of the heel. But it doesn't stop here. It actually spreads down and the fibers spread underneath the heel. When he came in and I palpated the heel, it was painful, but it wasn't painful where I thought it would be painful, which is further on the inside of the arch. So when I palpated his Achilles tendon, I came further down, I realized he had a lot of tenderness here. So he had insertional Achilles tendinopathy, which also resulted in heel pain. There are so many other causes of heel pain, I cannot even start to talk about all of them. Which is why it's really important to get yourself diagnosed by a podiatrist who can assess all the structures. Now, talking about plantar fasciitis specifically, if you have been diagnosed with plantar fasciitis, there's a couple of things you can do. These are some Dr. Foot Pro insoles, which I think are really good. I'm not biased, even though I did invent them. I often recommend putting a medial heel wedge, so a heel wedge on the inside of the heel, and sometimes a lateral, which is on the outside of the forefoot, another wedge. It tends to work really well to offload pressure to the fascia. Depending on what stage the plantar fasciitis or fasciosis is, I would recommend different products. We have a FXT night splint, which works wonders. We have a compression sleeve, it's called the FX6 rather, works really good. Products on their own won't do it. You need to stretch and strengthen certain structures. So usually it's the calf muscles can be quite tight. Now the calf muscles, you have two big muscles called the gastrocnemius, which two heads rather, and then you have another muscle underneath, which is a very strong muscle called the soleus. And you need to stretch and strengthen all three of these structures. There's specific exercises that I tend to recommend to patients, but I often also look at the entire body and I'm thinking, is there something else that is affecting the foot biomechanics to cause excessive pressure being placed on the fascia. It can often be an increase in weight. It can be a sudden activity. So sometimes the patient has suddenly gone on holiday, wore flat flip-flops, walked for hours on end, and caused the fascia to be inflamed. Sometimes they've started a new job, so they've gone from not walking very much to doing a job when they're on their feet for long hours. That can lead to it. Sometimes just offloading the fascia with an insole that has a lot of padding in the heel can work wonders. It really depends upon the individual patient. The kind of treatments I do, and I think most podiatrists do, is first of all, the conservative treatments tend to be stretching, strengthening, giving orthotics, which in most cases will be enough. Then I also tend to do a lot of acupuncture for it. I do K-taping for it. After 3 months, if they still have it, I will do shockwave therapy, which can be really effective. I do steroid injections, true meal injections, PRP injections. I mean, there's so many tools in a toolbox for a podiatrist that can use for plantar fasciitis or fasciosis. There's so many other things that we can do for it. However, diagnosis is key. Diagnosis is key. You really need to know if you have plantar fasciitis or if you have a different type of condition that is mimicking plantar fasciitis or is mimicking those symptoms. I hope this has been helpful. The takeaway message is get yourself diagnosed. Don't use Dr. Google. Go and see a podiatrist. Take care.